Hello friends, again we are continuing with the bone and ossology of belongs to anatomy. I am continuing the remaining part of the scapula. Yesterday we talked about the scapula part 1. In this part we discussed how to hold the scapula. This was the scapular bone. This is the bone of this side. This articulate with the humerus. This bone having three borders: superior border, the medial border which is near to the vertebra and so known as vertebral border, and an angulated border which is more thicker, that is known as lateral border. Three angle was there: the superior angle between the superior border and the medial border, the inferior angle between the lateral border and the medial border, and the lateral angle which is forming a cavity which is articulating with the only bone of the arm, that is known as humerus, and forming a shoulder joint that is known as glenohumeral joint. Okay, we talk a lot about the glenohumeral joint, why it is most prone joint for dislocation, what are the factor which is making it unstabilized, which are the factor which is making it more stabilized. We'll discuss a lot, and we will discuss in the rest in the shoulder joint. Okay, we discuss about three processes. One is this process which is known as spinous process with the acromion process, and a coracoid process and a glenoid process. We discuss all three processes and what are the structure attached on this process. Once again I am revising. We have to hold this bone in such a way that anterior surface or costal surface is concave, the posterior surface is convex, and a spinous process is there. This is posterior surface. This spinous process is dividing this surface into upper, supra, that means above the spinous, and another is infra, that is below the spinous process, fossa. This is the pit. Okay, this is the supraspinous fossa. This is infraspinatus fossa. Two fossae are there. One is supraspinatus fossa, infraspinatus fossa, and this is the spinous process. We discuss about the border and the attachment of the spinous process. Okay, this is the dorsal surface, and this is the ventral or anterior subcostal surface. Let's discuss about the attachment present on these angles, on these borders and these surfaces. First and foremost, I am drawing this. This is the fossa. This is the anterior surface which is concave. This is the anterior surface which is concave. In this anterior surface we can see there are some oblique ridges are there. These ridges are for the attachment of the tendinous origin of the subscapularis. Two-third part of this concave surface, give rise to the subscapularis. Sub means below. Scapula. Okay, it's not like that. It is actually not below. It is on the ventral aspect. It is arising from the subscapular fossa. I want to revise it again. From only two-third part, this is subscapularis which is originating. Again, I told you that this bone having articulation with the clavicle and humerus, this subscapularis is attached on the lesser tubercle of the humerus. When we study the humerus, we know that this passes anterior to the shoulder joint and attached on the lesser tubercle of the humerus. But this is the area which is having attachment. This area, this two-third area having the attachment of a muscle that is known as subscapularis. Okay, that about this surface. Now coming on to the dorsal surface. On this surface, two-third part of the infraspinatus fossa, or two-third part of the infraspinatus fossa, that is dorsal surface below the spinous process. Two-third part of the infraspinatus fossa give rise to the same name muscle, infraspinatus. infraspinatus, two-third part. Not only that, this is also arising from the inferior surface of the spine. Okay, it is in continuation. Infraspinatus muscle from the infraspinatus fossa, two-third part, from the lower surface of the spinous process, muscle originating infraspinatus, which attaches on the greater tubercle. Okay, above upper two-third part of supraspinatus fossa, above the spine on the dorsal surface, give rise to same name muscle that is known as supraspinatus. This give rise to the supraspinatus muscle. Very easy now. Above two-third supraspinatus, below two-third on dorsal surface or posterior surface infraspinatus, and ventral surface subscapularis. This is the origin of different muscles on the surface of the scapula. Okay, and these muscles are whether attached on the greater tubercle or the lesser tubercle. Thus muscle which is arising from the ventral aspect, this is inserted into the lesser tubercle. The muscle which are arising from the dorsal aspect are inserted into the greater tubercle. Okay, now one by one we are coming toward the attachment on the borders. Look at this. Very near to the root of the coracoid process there is a notch. This is the notch. This is the notch, and this notch is named as supra, means above, scapular, suprascapular notch, suprascapular notch. This is a notch because it is not closed. If it is closed like a tip of my pen by a ligament which is known as suprascapular ligament, now it's a foramen. Okay, this is a notch, suprascapular notch. Now suprascapular ligament is covering this one, and now this is a suprascapular foramen. The nerve, same name nerve, suprascapular nerve is passing through this area from here to here. Suprascapular nerve is passing through. Artery is passing above the foramen or above the ligament, so that artery cannot be compressed by the suprascapular ligament. Most of time, the artery above the ligament and nerve below the ligament passes through this notch and appearing here in a sphenoglenoid notch. This is the suprascapular notch, which is converted by the suprascapular ligament into the suprascapular foramen. It is traversed by the suprascapular nerve, and artery is traversing above this foramen. Okay, now very near to this, the lateral to this, medial to this, there is origin of inferior belly of omohyoid. This is the muscle of neck. Superior belly of omohyoid, inferior belly of omohyoid for making an intermediate tendon. Here is origin of the inferior belly of omohyoid. Okay, so this was attachment. Rest of the part, this border is subcutaneous. Okay, the major part to understand is suprascapular notch, suprascapular ligament, suprascapular artery and nerve, and omohyoid. Rest is subcutaneous. You can feel this one. Only supraspinatus is overlapping this one. Okay. Now I am coming on this vertical border. This vertical border or medial border, this vertical medial border having a ventral or anterior surface and a dorsal surface. When we're talking about the dorsal surface, if I am pulling this like my scapula like this one, this is an angle. On this superior angle there is attachment of levator scapulae. If it is moving like this, levator scapulae. Here is the muscle that is attached on the levator scapulae. Okay, then there is attachment of two another muscles on the dorsal aspect, that is